It's important for us to dive deep into a woman's hormonal cycle as a type 1 diabetic, because this is directly what's going to help you to get better blood sugar control. It's going to help you to be able to get through calorie deficits if you're trying to burn fat and lose weight more effectively. Know what to look out for so you can make the necessary adjustments to keep your blood sugars more stable. So when we look at this, just basically we're just going to go over this again so we understand each hormone and their impact on the body. So we know that a woman's natural cycle is going to last about 28 days on average. So you could get 21 days to 35 days. We've got an average of 28 days. What happens in that 28 days? Hey, I'm a guy, so it's a little easier for us. I will say that. Got to give it to you ladies. It's a little harder for you guys. When we dial this in, we can really take it to the next level. So we know from about day 1 to day 14, we're going to be more in what's called your follicular phase. And then day 15 to about day 28, we're going to be more of our luteal phase. This is important, but we'll circle back to that. Now, the different hormones that are key for us to take a look at here today are estrogen, progesterone. These are our top two right here. Then you also have follicle stimulating hormone and luteinizing hormone. Now let's go to the beginning. What's going to happen over here when we're in our menstrual phase, let's say day 1 to about day 7, when we're shedding that uterine lining? Not we, but you guys or you women. What ends up happening now is you've got low levels of estrogen and low levels of progesterone. And progesterone's job, which we'll understand later in what's called your luteal phase after day 15, is to keep the uterine lining more intact to be able to get ready for pregnancy, to the fertilization of the egg, which doesn't happen. So as a result, progesterone goes down, estrogen goes down, we shed the uterine lining, and we're in between about day 0 to day 7. What we have to note that starts happening between day 0 and day 7 is estrogen is going to start to rise. Estrogen starts to rise because follicle stimulating hormone gets triggered. As follicle stimulating hormone gets triggered, follicle stimulating hormone starts to trigger what's called follicles in the ovaries, which then develop into a mature follicle, which releases an egg to be fertilized or not fertilized. As that increases, estrogen starts to increase. Estrogen's our blue line right here. Estrogen is key because estrogen is going to improve insulin sensitivity in your body. Estrogen can also help with energy levels. So you're going to feel more vitalized when you have more estrogen in your system. Now, at the beginning, of course, we're going to get some cramping there. That's just part of shedding the uterine lining. You're in your mid to late follicular phase. You might actually have more energy. You might notice you can lift more weight. And you might also notice that you're having easier times getting through things like HIIT training. And the reason for that is because you have higher insulin sensitivity, so it makes it easier for glucose to get into your body cells. As a result, this can help you to push heavier weight because weight training is anaerobic, meaning it revolves around using glucose mainly to fuel that workout. So if you have higher sensitivity, we can get glucose in easier, so you might feel better during those workouts earlier on. Prime time to utilize carbohydrates to really help the body to feel good during these workouts, since your sensitivity will be up. Once we start getting around day 7 to about day 14, just before day 14, you're gonna see that estrogen starts to really peak. So you could say maybe around day 10, day 12, you're starting to get a higher peak on estrogen, meaning more sensitivity. This is important because we could technically break down that follicular phase into two parts that are going to be important to take a look at when it comes to your blood sugars. The first portion is maybe day 0 to day 7, where you notice that estrogen is starting to increase, but it hasn't really fully skyrocketed yet in that follicular phase. So maybe you might have to decrease your insulin needs from your previous phase of a luteal phase. And this might be like more of a baseline for your blood sugars in terms of where your ratios are here. As we start to get past day 7 here, and you're getting closer to ovulation, estrogen levels are going to start to dramatically increase. This is because there's a mature follicle after being stimulated by follicle stimulating hormone that's now releasing more estrogen into your body's system. As a result, these higher estrogen levels mean that between day 7 and maybe day 13, we might notice that you actually need to decrease your insulin needs even more, just because we know that increased estrogen can lead to increased insulin sensitivity as well. So if you start noticing things are weird after that day 6, day 7, and you're like, wow, I'm starting to go low here, this could be the reason for it. So now you've got to have a new basal segment for this time over here, or a change in insulin to carb ratio sensitivity during this time. Now at this point, estrogen levels are high. It's going to trigger what's called luteinizing hormone as well. So with that high surge in estrogen, luteinizing hormone spikes up over here in the orange. And then what ends up happening is it ruptures the follicle, which then sends the egg through out of the ovaries through the fallopian tube, which gets ready for fertilization. So once that scenario happens, now you're going to get a rise in progesterone over here. So now let's say we're past day 14, we're headed into our luteal phase now. Now we can section the luteal phase off into two segments as well, just like the follicular phase. In the luteal phase, your body might need more insulin now as a result of progesterone. And our green line over here is the progesterone increases insulin resistance. The body tends to utilize more fat for fuel during this phase. We could also tie that into increased insulin resistance as a result, harder to get glucose into the cell, body's burning more fat for fuel. One way to look at this is consider when you get from to day 14, day 15, you're gonna slowly start to need a little bit more insulin need. So basal might have to go up, insulin to carb ratio has to go up in terms of how much insulin you're taking. And then when you get to a peak point, so let's say it's close to day 21 over here, around day 22 out of our 28-day example, you might need your highest amounts right in that mid-luteal phase, right? Then as you start to taper off towards the end of day 28, progesterone starts to lower, especially if the egg has not been fertilized. And progesterone's job is to keep the uterine lining more intact to prepare for pregnancy. But if it doesn't happen, progesterone starts to go down again. Estrogen has a quick peak and then goes back down again. And then we shed the uterine lining and we're back to day number 1 as well. How we break this down for you guys is consider that there's 4 different types of phases where you're gonna have to change your insulin needs. So if we're thinking about day 0 to day 7, when estrogen levels are starting to rise, but they're not at their peak, you're gonna need a little bit less insulin than you did need in your luteal phase, which was the phase prior to that, your late luteal phase. So you gotta be mindful of changing your insulin needs slightly and maybe a different basal program, different insulin to carb ratio for that time, so you can have more control there, right? Now, as you get to day 8 to day 13, 14, estrogen is really gonna peak. So you're gonna need even more changes to reduce the amount of insulin that your body is taking in. Change the basal program again. So that might be a second basal program here, or it could just be a change in your insulin to carb ratio to be a little bit less as estrogen starts to dominate and makes you more sensitive. Also, if we now push past day 14, day 15, we're in the luteal phase. Now compared to your previous phase, late follicular phase, just after ovulation, you're gonna need slightly more insulin for about 7 days there as progesterone starts to increase. Now, as you get to mid-luteal, you're gonna need even significantly more potentially because now we've reached the peak of progesterone, which is gonna make you even more resistant. So as part of our 4th change to what we do, you might have to slowly increase that basal segment again. Now, so far, we have early follicular, day 0 to day 7, day 7 to 14, mid to late follicular, where we need less than we did over here. Over here with the luteal, this is gonna be our 3rd basal program or settings that we have set up. You're gonna need a little bit more than you did the previous phase, but as you start to get to day 21, you're gonna need even more as a result of the highest peak of progesterone, which is there around mid-luteal phase. Now, as you start to get to the end, you might even notice you need a 5th one. Now, the key thing is to know where you are and what you notice with your blood sugars. But when you can stamp these hormones on top of what you're noticing with your blood sugars, you better know what to look out for and why certain things might not be as regulated as they were a previous time in your cycle. Now, what you can also do is keep things simple. So for a month, consider keeping your meals very simple and seeing how things change outside of that. If someone's eating all over the place, it's hard to know where your ratio should be. But if you dedicate yourself to 28 days of just clean, healthy eating, call it a 28-day challenge, like a 75-day hard, where you're just trying to figure out, by keeping your meals very simple, how does my insulin to carb ratio needs change at different points in this month, so you actually know how different things are. Because if you're eating high fat, high carb, not counting the carbs, it's hard to know exactly where you should be because we don't know if it's a carb counting error, a higher fat issue, you worked out here, you didn't. start looking out for these things. I always say it's better to know why something's happening so you can make the changes than not know the why. Because if you don't know the why, your calendar is going to look crazy with your blood sugars, kind of like our lines over here on our chart, and you're gonna wonder what the hell is going on. Hope that helped you guys out. If you guys have any questions at all, just drop them down below in the comments. I got you guys as usual. It's Coach Jay. I'm outie.